Hey, Team BCN. On the podcast today, we have with us Sabrina Partin, BCN's HR Benefits Program Manager, and she's going to help us get ready for open enrollment for our 2023 benefits. Sabrina, welcome.
Thank you, Heidi.
Sabrina, you held the annual Open Enrollment's education meeting on October 25th. It had a lot of information in it. What if someone wasn't able to attend the live Teams meeting?
It was recorded, and I will be sending out a link to the recording so anyone who missed it can watch it at their convenience.
That's awesome. I know there's one important takeaway that you want to make sure everyone knows. So I want to share that at the top of the podcast.
Yes, I need everyone to know that your medical coverage from 2022 will not roll over to 2023. You must go in and elect your medical coverage for 2023. If you don't, you won't have it. I cannot stress enough. You must go into Paycor and elect your medical coverage for 2023.
That is important information. When is open enrollment?
Open enrollment will be live in Paycor from November the 1st to November the 14th.
All right. Let's begin by laying the groundwork of our health insurance plan. In the meeting, you mentioned that BCN is self-funded. What exactly does that mean?
We always talk about Anthem being our insurance company, and it's easy to think that they pay our medical bills, but it doesn't really work like that. In truth, we, BCN, pay Anthem an administrative fee to rent their network of doctors and organizing the billing for us. That's what they do. Because of HIPAA, BCN isn't allowed to see people's individual claims and bills. Anthem gets all of those bills, organizes them, pays the doctors and the services. But what we have to do is reimburse Anthem for those claims that they pay. And when it comes to actually footing the bills, that falls on BCN. So BCN is self-funded, which means we are responsible for all of the insurance claims. In HR onboarding, I tell new hires to think of it as a large pot of money that is budgeted for our healthcare. BCN puts in their part of the budgeted amount, and team members put in their premiums from their paychecks, and then the claims start coming. Every time you go to the doctor, your copay is $30. But if the doctor charges $100, then BCN has to pay the other $70 out of that pot of money. If we have more claims than we've budgeted for, then that pot is going to go empty. Since we have to continue to provide health care that we've told you we would provide you for the current year, that money has to come from somewhere else if that pot goes empty. That's why we ask our team members to try to be good stewards of our healthcare dollars. If you're sick and a regular doctor's visit would do, don't go to the ED. Use Marathon Health or go to your primary care physician. If you can't get in with them, then your next stop is urgent treatment. Save the most expensive places of service, such as the ED, for true emergencies. It'll save you money and it'll save our plan money. If your doctor wants you to go down the hall to have blood work at their facility, ask them if they can write you an order and you can take it to LabCorp, where it'll be free for you on the PPO plan and billed cheaper to BCN. BCN health insurance premiums have been on the rise for years. Our CEO, Liz Fowler, put out an email that our health insurance costs have doubled in the last 4 years. They were $4 million in 2018, and they're now $8 million. BCN has absorbed most of that increase, but we've had to look at every avenue to reduce cost.
That's good information to know, Sabrina. Thank you. A 2023 change that you spent a lot of time talking about in the education meeting was charging tobacco users a different rate for health insurance than non-tobacco users. Can you tell us how this came about, what the rate difference will be, and if there's anything tobacco users can do to lower their rates?
Information from the CDC and other studies show that individuals who use tobacco have greater lifetime medical expenses. Because tobacco users contribute to higher company medical costs, we believe that they should contribute to a higher extent than non-tobacco users. BCN has defined tobacco use, and that definition will be available to all team members in an attachment in Paycor. It'll be in an email I send out, and it's on the affidavit they have to sign. If a team member has met that definition of a tobacco user, then they will have to pay an additional $25 per pay period towards their own health insurance premiums. If they cover their spouse on the health plan and their spouse is a tobacco user, then they will have to pay an additional $25 for their spouse's premiums as well. To be clear, if there's one adult tobacco user on the plan, it's an additional $25 per pay. If there are two tobacco adult users on the plan, it's an additional $50 per pay. If someone's dependent child is a tobacco user, they will not be charged for that. The affidavit does not inquire about children's tobacco use.
Okay, I just want to be clear on that point. So children are allowed to be on the health insurance up to age 26. So even if a team member has their 25-year-old child on the plan and the child is a tobacco user, they do not have to pay the $25 for their child's tobacco use. Is that right?
That is correct.
Okay. Sabrina, you mentioned a tobacco cessation program in the meeting. What is that and how can it help our team members?
When your health insurance plan charges a different rate for tobacco users, that plan is required to offer what's called a reasonable alternative standard, since some team members do not meet the health standard for being a non-tobacco user. That alternative is a tobacco cessation program. If tobacco users complete an HR-approved tobacco cessation program by March 31st, 2023, which is 90 days after our 2023 plan starts, and they can show proof that they've completed the program, then they will be charged the non-tobacco rates, and any tobacco premiums that they were charged prior to completing the program will be refunded.
Wow. Does every tobacco user have this option?
Yes, team members and their spouses can enroll in the tobacco cessation program, complete the program in 90 days, and the additional cost of the $25 or the $50 will be removed and refunded.
Okay, that is good to know. Let's talk a little bit more about the tobacco cessation program. What exactly is this program?
So there are two that BCN has pre-approved. One is called Quit Now Kentucky, and the other is called Freedom from Smoking. Links and the number to those programs were on the presentation from 1025, and they will be in the email that I send out. They were also in the frequently asked questions that we have put together. I put those links in the chat during that meeting, and they will be in the email I send out.
Okay. What if someone has another program that they would like to use?
It must be pre-approved by HR. So they just need to get me that program's information.
Okay. You've also mentioned an affidavit a couple of times. What is this affidavit?
Every BCN team member on our health plan is required to turn into HR an affidavit regarding their tobacco usage. There's going to be three options on the affidavit. Number one, you are not a tobacco user. Number two, you are a tobacco user, but you plan on doing the smoking cessation program. Or number three, you are a tobacco user, but you do not plan on doing the program. If you have your spouse or your domestic partner on our plan, you must also make the same attestation for them.
Okay. Where is this affidavit that we have to sign?
It will be linked in Paycor to the medical elections. It is also linked in the email that I'll be sending out, and it needs to be returned to HR by the end of open enrollment on November the 14th.
Okay. Thanks for that, Sabrina. Let's talk a little bit more about other changes that were made to the health insurance this year.
Unfortunately, to combat the rising healthcare costs, we had to increase the deductible for the PPO and increase the out-of-pocket max for the PPO and the high deductible health plan.
Okay. What do people need to do to figure out with these changes which plan is right for them?
They really need to look at their healthcare expenses and see if they meet their deductible or not. See how much would their medications cost them if they didn't have a copay and they had to pay the entire price for that medication on the high deductible plan. They need to compare those expenses and look at the cost of the premiums they're paying and see what plan best meets their needs. One thing I mentioned in the presentation is just the price of premiums. The high deductible is $948 cheaper than the PPO plan for the employee-only coverage. Then BCN puts 480 into their HSA for the people on the high deductible plan. That's a $1,404 savings right off the bat for the employee only coverage of the high deductible plan. So if you keep your premiums if you keep your costs below $1,404 a year on health care, then mathematically you're actually better off taking the high deductible plan than you are the PPO plan because you're saving money in premiums. We're putting money in your HSA for you and you're saving money.
Mhm.
Now that both plans have a $3,000 individual deductible, there's no longer a savings there for people on the PPO. The savings comes in terms of doctors and prescription copays. So people on the PPO need to calculate how much it would really cost them compared to the extra in premiums they're spending. I always say that the high deductible plan works great for people who are really high users of healthcare, but because it has a lower out-of-pocket maximum, or it's great for people who are low users of healthcare because the premiums are less, and if you don't use it, you won't be out any claims. The final thing I want people to think about is do the math and see if it's cheaper to have your spouse and your children on the BCN plan, or if it might be cheaper to have your spouse and children on your spouse's plan. And open enrollment is the time of year that you can make all of these changes.
That's really good to know, Sabrina. Let's talk about one money saving opportunity, and that's Marathon Health Anywhere. Can you tell us a little bit about Marathon Health?
Heidi, I am a big fan of Marathon Health. They are a healthcare provider that we partnered with in March of 2022, and they provide free virtual healthcare to our team members that are on the Anthem plan. Not just the team members, but also the team members' families that are on our Anthem plan. They provide primary care and sick care visits. They can order medications. They can order labs. They have a concierge service that will help arrange referrals if you were to need a specialist. They can monitor your chronic health conditions such as high blood pressure, diabetes, asthma. And they also have health coaches who will help you develop a plan based on where you are now and where you want to get to in your health journey. They also have a behavioral health division that can offer you and the people on your Anthem plan counseling.
That's amazing. And all of this is free?
Absolutely. This is a part of the offerings to those who are on our Anthem health plan, not only for, again, the team members, but also their families that are on the plan. There's absolutely no charges for any service that Marathon provides. Now, I do want to be clear. If they order you lab work, there could be a charge from the lab that you go to get that lab work done. But for the service that Marathon itself provides, absolutely no charge.
That really is amazing. Do you have any data on people using Marathon Health Anywhere? And if so, how they're liking it?
Heidi, again, because of HIPAA, we don't know who is using Marathon services or what exactly they're seeking care for. I do get a monthly report from Marathon that updates me on the enrollments and the general usage. The last report I got was dated September 30th, about 6.5 months into our Marathon journey. And we had 245 people who had already enrolled in Marathon. That 245 is not only our team members, but also their family members. We have around 1,000 people on our Anthem plan when you include the family members. So that means that almost 25% of the people on our plan are signed up for Marathon. And that's encouraging. Of those 245 that have signed up, 84 different people have completed a visit. That's only about 8% of the people on the plan. And we would love to see that number go up. After you have a Marathon visit, they send you an email asking you to take a survey. And I'm not sure how many people actually go do the survey, but the ones who do have rated them 100 for what they call a net promoter score. So that sounds like the people who've had an appointment and taken the time to do the survey have been pleased.
That's really good to know, especially since it's a free service and a great way to save money. If 84 people have had at least one appointment each, that is some serious cost savings.
It really is. If all of them had the PPO plan and they saw a doctor at a $30 copay, that would have been over $2,500 that they saved in office visits. And if those people had the high deductible health plan, then it could have saved them as much as $100 a visit. So now you're talking about an $8,400 savings. But it cost our team members absolutely nothing. And you're right, that is serious savings.
Okay, so while we're on the subject of our insurance, what is the difference in an FSA and an HSA?
That's a great question. And some people get them confused. An FSA is a flex spending account. That is the preloaded account that you can sign up to $3,050 a year in order to help you pay for your medical expenses. Your money is in the account on January 1st, and it's designed for people on the PPO. And you will use that account all year to pay for medical expenses. The HSA is a health savings account, and it's for people who have a high deductible health plan. It allows you to put money into that account. And I said earlier that BCN puts up to $480 a year in the account for them. You can invest that account, and you then take money out of that account to pay for medical expenses throughout the year. The money is never taxed at any stage, and an HSA can be spent when you need it, or again, it's a savings account, so you can save it over time and pay for medical expenses later.
Okay. What kinds of things can I buy with my HSA or my FSA?
Heidi, this answer might surprise you because it's going to be more than you think it is. You can use your HSA and FSA to pay for medical expenses, such as copays and deductibles, but you can also use it to pay for over-the-counter items, such as Band-Aids, cough medicine, acetaminophen, ibuprofen, condoms, pregnancy tests, feminine hygiene products, shoe inserts, first aid kits, glasses, dental work, braces, canes, all kinds of things. You can find the whole list of stuff that you can use your FSA and HSA card for at healthequity.com/QME. And you would be amazed at how many things you can buy with your pre-tax money.
Yes, I've looked at that list, Sabrina, and I was amazed. I really had no idea that so many things could be purchased with HSA, FSA money. Your meeting also focused on a few changes with our voluntary products, our accidental injury and critical illness. For one, can you summarize those changes for us?
We are switching vendors from Cigna to Allstate for our critical illness and our accidental injury. The new Allstate plans are similar to our current plans with Cigna, but actually provide more coverage. The accidental injury plan pays you for various treatments you have if you've had an accident, and the 2023 premium is actually lower than the 2022 premiums you're paying with Cigna. And the critical illness plan is a bit more expensive than the rates we pay right now with Cigna, but the coverage is doubled, and it covers 17 additional illnesses. The current Cigna plan covers 9 illnesses. The new Allstate plan covers 26. These are voluntary coverages, and they help put money in your pocket if you have an accident or one of the critical illnesses. I always say that your medical insurance is going to take care of most of your medical bills, but this is going to put money in your pocket to help you pay that $3,000 deductible or the office copays. Both plans, as well as our cancer plan, which we've had with Allstate for years, comes with a wellness rider. So if you have a wellness screening, such as a biopsy for skin cancer, your lipid panel, a chest x-ray, colonoscopy, mammogram, pap smear, stress test, then they would give you back anywhere between $25 and $100, depending on which coverage you have. And for the accidental injury policy, even a dental cleaning counts as wellness.
Awesome. Tell us about short-term disability.
If you are unable to work because of your own disability, then short-term starts paying you on week 3 of your disability leave. It pays you from week 3 to week 12. And the exciting news for open enrollment this year is that you can increase the amount of short-term disability that you elect. Currently, the max amount you can have is $750 a week. In 2023, the max amount is $1,500 a week. You have to look at the salary chart to make sure that you're eligible to buy a certain amount, because you can only purchase up to 70% of your salary. The other exciting thing about this open enrollment is that we got a 42% rate reduction for short-term disability. So if you were paying $25 a paycheck for a $500 weekly benefit, then in 2023, that same $500 weekly benefit is only going to cost you $14.38. So you can either pocket that savings, or maybe you're going to decide to up your weekly benefit and purchase more. If your salary would let you, you could increase from that $500 weekly benefit to $850, and it would still cost less than the $25 per pay you're paying now.
Any reduction is exciting news, so thanks for explaining that to us, Sabrina. You also said in the October 25th meeting that you can apply for these coverages with no medical questions. Is that correct?
Yes, and that is wonderful news. We are having what I call an open enrollment, which means if you want the AI, the CI, the cancer, the short-term disability, all you have to do is elect them in Paycor. You do not have to do any paperwork. No medical questions. You have guaranteed approval for yourself, your spouse, and your children. Even if you have been turned down before, you are guaranteed to be approved now. No paperwork, just elected in Paycor.
That is awesome. What are other general things that people need to know about open enrollment this year?
People's 2022 voluntary life coverage, either on themselves, their spouse, or their children, will copy over to be their 2023 amount as well. If you want more voluntary life, you will need to do a medical questionnaire for that. And that medical questionnaire is due to me by November 14th, which is the last day of open enrollment. The 401k will not be included in open enrollment because you can make changes to your 401k any time of year. And then finally, the base life insurance and the long-term disability insurance, they are not included in open enrollment because all full-time team members are automatically enrolled in those two coverages because BCN provides them at no charge.
All right, Sabrina. In closing, remind us again what will roll over in Paycor and what has to be elected for 2023.
So dental, AI, CI, cancer, short-term disability, and voluntary life will roll over. Whatever you have in 2022 will roll over to be your 2023 coverage. Medical, vision, FSA, and HSA will not roll over. So you must go in and make your 2023 elections for those four things: medical, vision, FSA, and HSA.
All right. If someone missed your presentation, remind us where they can find it.
So it's on SharePoint, and I will be sending out a link later this week in an email that will cover all of the open enrollment details, but there will be a link to that recording in there.
All right, Sabrina, thank you so much for your time today, and thank you so much for sharing this information with us.
Thank you for having me. I had a great time.